Let's start today with the significant deal between the Liberals and the NDP on Pharmacare. After weeks of threatening that their overall supply and confidence deal to prop up the government was in jeopardy over the issue of Pharmacare, it appears it no longer is. The NDP say legislation to introduce single-payer universal Pharmacare is coming this week by that March 1st deadline as set out in the Confidence and Supply Agreement. Jagmeet Singh is the leader of the NDP. Hi, Mr. Singh. Good to see you as always. Thanks for making the time.
My pleasure. Thanks for having me.
Is there a timeline attached to it? Like for Canadians who are watching now, might they have coverage for that sooner rather than later?
Yes, that's exactly what we're hoping for. We look at the childcare funding and the deals struck with provinces as an example of how quickly we can move. Because it's specifically two classes of drugs, because the federal government will be stepping up to provide supports to make this happen, we are confident we can get this done very quickly.
To be clear, though, is any of that specified in the legislation? Like, is any timeline for either those drugs or the implementation of universal single-payer Pharmacare? Is that any of the timeline spelled out?
The specifics around the two classes of drugs, there's elements of that are laid out, and that can't get into too much of the details because it's in the legislation. But we have some strong assurances, and we'll have language that will allow us to move very quickly on this. And again, this is going to mean a huge difference to people that are using diabetes medication right now and have worried about the cost of it and have said it's just too expensive and have really thought about skipping pills or not taking their injections, even though that would put them in severe risk. For folks like that out there, we are going to give you some real hope with universal coverage of those diabetes medications very soon. It's going to be committed in this legislation.
What about the bigger picture around the implementation of that universal Pharmacare? Because, and I'm asking about a timeline, because of the counter that the Liberals had put forth publicly during these negotiations, which is the associated costs, and that it's not something they can afford now. I know that part of your deal wasn't about the cost, it was about implementing the legislative framework, but obviously the legislation is only as good as the implementation ultimately. Do you have any guarantees from the government, and Canadians, do they have any guarantees today from the government that this isn't something that will continue to be punted down the road 15, 20 years from now?
It's a very fair question, and if left to the Liberals on their own, yes, they would be punting it down the road indefinitely. That's what they've done in the past. It's not really a surprise. They've done that for 30 years, so they would be happy to do it maybe for 3 more decades and just string people along. That's why we've locked in really concrete first steps with real clear commitments to getting that done quickly. And looking at the childcare example of we can get this done as soon as possible. There's real commitments, this will move forward. So those two, diabetes and for contraceptives, we can see very quick action. For the broader bringing in Pharmacare, that's where it's going to be an ongoing battle. We have laid out the foundation with this legislation, which is what we wanted to do. And I've been very convinced that if we really want to move forward, the best way to do that is to elect more new Democrats. The Liberals have dragged their feet. The Conservatives definitely don't want this. If this is something that matters to you, we are the ones driving it.
Are you sure, though, even if you did form government, Mr. Singh, with all due respect, that you would be able to drive this forward? And I'm going to tell you why. We reached out to a number of the provinces about how they felt about the prospect of universal single-payer Pharmacare. The government of Quebec said that if the government of Canada goes ahead with this drug insurance project, the government of Quebec will demand an unconditional right of withdrawal with full compensation. The government of Canada should let the provinces take care of their areas of expertise and play its role of adequately funding care by increasing health transfers. New Brunswick said, I would like to hear the details before any announcement. To announce such a program without consultation with the provinces is irresponsible. Alberta says Alberta's government was not consulted on any national Pharmacare plan, and there are limitations in the initial analysis and assumptions, including startup investment and administrative costs to implement a cost-sharing model that were not taken into consideration that add costs for provinces. If the federal government pursues a national Pharmacare program, Alberta intends to opt out of the program and to instead receive our full per capita share of that funding for deployment into our provincial healthcare system. Why would you force the feds to do something before talking to these provinces?
This is not different from universal healthcare. At the time, provinces balked at the idea of universal health care. No different. It took time, it took negotiating, and it took some provinces stepping up and agreeing, and then other provinces followed suit. But you can go back and look at our history and see the exact same or similar comments from other provinces at the time, and now it's one of the things Canadians are most proud of. If you ask Canadians, poll them, What are they proud of? Proud of the fact that we do have a social safety net. We do have universal health care. But at the time when it was first introduced, provinces balked at it then too. That's why it's going to take hard work. We know the evidence is clear. The best way to lower costs is to have a universal single-payer program.
You referenced, Mr. Singh, though, universal health care and the challenges it initially faced. I mean, there are monumental challenges our healthcare system across this country and each and every province faces at the moment. To the Quebec government's point about wanting to see an increase in federal funding, or federal transfers rather, for healthcare over the creation of a new program, how can you justify to Canadians who are watching today who don't have a family doctor, who have to wait hours in an emergency room for their kids' most acute illnesses, who are frustrated beyond belief at the surgical wait times, that the government should be instead directing the limited funds they say they have to Pharmacare, a brand new program, instead of trying to improve the program we have?
We need to do all of it. I hear families. I've been in emergency rooms with my daughter waiting hours and hours and hours for care. It is incredibly frustrating. People don't have access to family doctors. Also, 1 in 4 Canadian is not taking the medication they need. Recent report came out, 1 in 4. Out of all Canadians, you have 1 in 4. So 4 people walking down the street. One of those people is not taking the medication they need, skipping pills. And we know what happens when you skip pills and don't take medication that your doctor prescribes. You end up in the emergency room. You end up with the illness getting worse and worse. In the case of diabetes, if you skip medication, you end up with renal failure and you might end up on dialysis, one of the most expensive and most intrusive procedures that you have to do forever, ongoing, if you have renal failure.
With respect to Mr. Singh, what if you can't even get into the doctor? I think that's the point that a number of provinces are making, right? And I understand that those two programs can go hand in hand, but right now the basics are not even covered for most Canadians. And I think that unless you don't think that there are finite resources for the federal government, it would be difficult for them to increase funding to the regular healthcare system and create a new $10 billion system a year annually. Even though there are savings for Canadians within there, it still does cost their bottom line.
Well, we absolutely believe we need to do both. And I don't accept at all for a second that we can't do both. We can and must. The federal government's been cutting federal funding for healthcare for decades and decades. That's the wrong thing to do. We know that our federal our costs in general for healthcare are going to continue to climb if we don't cover medication. We see the writing on the wall.
Just before I let you go, Mr. Singh, I wanted to ask you about the deal overall with the Liberals. You've checked a lot of boxes now with this part of the agreement. This was a big part of it, but you've checked a lot of other boxes as well. Do you still see the utility in that agreement?
Well, our vision is that we're going to keep on fighting with everything we have in a minority government to give Canadians as much relief as possible. We're going to squeeze as much as we can out of the Liberals, and then I'm running for Prime Minister. And that's our plan. We're going to stick to that plan.
What does squeezing as much out of the Liberals mean? And again, I'll circle back to the actual agreement. I went through it line item by line item. There's very few things left that have not been checked off. Are you going to add to that list, or are you just going to kind of offer your support based on what's already happened and not anything predicated on the future?
Well, the dental care piece, which is significant, that's not yet completely rolled out. So we still need to see a rollout. We want to see people receiving that care, and we want to see it work. The Pharmacare, we've locked in these important commitments. We also want to see that happen. So there's still more work to be done, and we want to make sure that work is completed. But we're not going to let the Liberals off the hook. We've been very clear with them. If they break their commitments, they break their promise, they don't follow through, we have repercussions that we can put in place.
Since Parliament resumed this year, you've called the Prime Minister, quote, bad, really bad. You've said, quote, he fails to uphold reproductive rights, that he, quote, stood by and did nothing about auto thefts, that he and his government, quote, bankroll corporate greed, that he, quote, sided with rich developers, that he, quote, favors the ultra-rich, and finally, quote, under his leadership, things got worse for people. You remain the key ingredient to keeping him in that position. What do you say to Canadians who want the chance to address exactly what you spell out, but you and your party are preventing them from doing so?
Well, I would say to them, we are the ones that are making this government do things that they would not have otherwise done. We're the ones that forced them to double the GST rebate, putting more money in people's pockets. We are the ones that forced a dental care program that's going to help millions of Canadians. We're forcing the government to move forward on Pharmacare. We're getting things done for people, and we're going to continue to use our power to do that. Ultimately, there will be an election, and then in that election, Canadians will choose what they want to move forward. But while we have the opportunity to force this government to work, our job is to make Ottawa work for people.
Mr. Singh, I'll leave it there. I appreciate your time as always. Thank you.
Thank you.